Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Now we look into the mechanism of peristalsis. So here in case of the peristalsis, the mechanism first is a local stretch release of serotonin. This local stretch releases. The local stretch, it releases the serotonin. So since because of the local stretch of the serotonin, this leads to the activation of the myenteric plexus. So activation of the myenteric plexus. So what we saw is first is a local stretch release of the serotonin. This causes the activation of the myenteric plexus. Because the myenteric plexus is activated, there is an anterograde direction and the retrograde direction. So in case of the anterograde direction, there is NO and VP are NO and VIP. So both NO and VIP, they are released. Next is the smooth muscle relaxation is ahead of the stimulus. Next is there's a retrograde direction. There is something known as a retrograde. So in case of the retrograde direction, the substance P and the acetylcholine are released. So two things are released in retrograde. In retrograde, there is a substance P. There is substance P as well as the acetylcholine. So to recap, the anterograde, it includes the NV, that is a NO, and the VIP, they are released. In case of the retrograde direction, they included the substance P. So there was substance P as well as the acetylcholine, which was released. Now in case of anterograde direction, there is a smooth muscle relaxation ahead of the stimulus. So in case of anterograde, there is a smooth muscle. So what is the role of smooth muscle here? There is a relaxation ahead of the stimulus, whereas in case of retrograde, which involving the substance P and the acetylcholine, there is a smooth muscle contraction behind the bolus. The smooth muscle contraction, and this contraction is behind the bolus. To learn and grow daily like this, please do subscribe.